Hello everyone. Hello everyone. Hello everyone. Hi there. I am a psychiatrist, and I make mental health education videos. This is a quick guide to mental health care. If you are new to my channel, welcome here. I try to make mental health education videos that are easy to understand and apply to real-life situations. So if this kind of content is of interest to you, consider subscribing. So what is the purpose of this video? This video is for people who are new to mental health care or have not accessed mental health care before, but need some help with mental health challenges they are facing. And it's also for those who have been in therapy or with a psychiatrist for some time, but aren't sure how to maximize their treatment. The goal is to help you get more value from mental health treatment. Another thing I want to say is that this video is not meant to be a replacement for any face-to-face treatment. So don't delay or avoid seeking treatment because of this video. It's just a starting point to help you better utilize treatment when you start it. Alright, let's begin. First, we'll talk about what to expect at the first visit. You will fill out paperwork. This is usually done before you see the provider. Sometimes you can do it over the phone or online, sometimes both. The purpose of the paperwork is to collect information about your current concerns, your personal history, family history, medical history, and substance use. It's important that you are as open and honest as possible on these forms. You can always go back and change things later if you wish, but the more complete and honest the information is, the better the provider can understand your situation and work with you to address your needs. After the paperwork, you will meet with the provider. At this meeting, the provider will go over the paperwork with you, ask additional questions, and perform a mental status examination. The mental status examination is basically an interview where the provider assesses your appearance, how you are feeling today, your mood, and affect how you think, and if you have any psychotic symptoms like hallucinations or delusions. The provider will also explain their role, what to expect during treatment, and answer any questions you may have. After the first session, you should have a sense of what to expect during future sessions and what you can do to improve your mental health. If there is an emergency and you need immediate help, you will be advised on how to get that. If medication is recommended, a prescription will be written and instructions will be given on how to take the medication. It's important to follow these instructions carefully and ask questions if anything is unclear. If you are not comfortable with the provider, you may ask to be referred to another one. Most mental health providers will accommodate this request. Here's what to bring to your first appointment. Bring your insurance card and a photo ID. Also bring a list of all medications and supplements you are taking. A list of your daily activities and obligations can also be useful. For example, work, school, social activities, and other appointments. This helps the provider understand your schedule and how you spend your time. It's also good to have a list of your goals for treatment. What do you hope to accomplish? Lastly, bring any relevant documents, records, or test results that could be helpful for the provider. Next, I'll discuss what to expect at follow-up visits. Follow-up visits are usually shorter than the first visit. During these visits, the provider will ask about your progress since the last visit, review your medications and adjust them if needed, and work with you to accomplish your treatment goals. It's important to be honest and open with the provider about your progress. If you're not making progress, say so. If you're doing well, let the provider know. And don't hesitate to ask questions if anything is unclear. If you're in individual therapy, each session will have a different focus depending on your needs. But here's a brief overview of what might happen during individual therapy. In the beginning part of treatment, therapists will probably ask you questions about your personal history, family history, and medical history. They will also ask you questions about your current concerns and why you decided to start therapy now. The therapist will also explain the purpose of therapy, how it works, and what to expect during treatment. The therapist will also let you know their theoretical orientation. This is the therapist's approach to therapy. There are many different orientations such as psychodynamic, cognitive behavioral, person-centered, and others. Each has its own strengths and limitations, and the best one depends on the client and the issues being addressed in therapy. Once the logistics are clarified, the therapist will work with you to identify your goals for therapy. What do you hope to accomplish? And then you will work together to develop a treatment plan to accomplish those goals. As treatment progresses, you will work through issues and develop coping skills. There will be homework in between sessions. This is something you will work on outside of session to help you practice new skills and apply them to real-life situations. During individual therapy, there may be times when you feel uncomfortable, angry, or confused. This is normal, and the therapist is there to help you work through these feelings. It's important to be honest and open with the therapist and to communicate any concerns. If you're not comfortable with the therapist, you may ask to be referred to another one. Most therapists will accommodate this request. In group therapy, each session will have a different focus depending on the needs of the group. But here's a brief overview of what might happen. Group therapy is a unique experience where you will get to interact with other people who are going through similar issues as you are. There are many different types of groups, such as process groups, skills groups, and support groups. Each has its own strengths and limitations. During group therapy, you will learn new skills, gain insight, and get support from other members. There may be times when you feel uncomfortable, angry, or confused. This is normal, and the therapist will be there to help you work through these feelings. For couples therapy, each session will have a different focus depending on the needs of the couple. But here's a brief overview of what might happen. Couples therapy is a great resource if you are having issues in your relationship. During couples therapy, you will learn new skills to improve communication and resolve conflict. You will also gain insight into your role in the relationship and the role of your partner. The therapist will help you identify your goals for therapy and work with you to develop a treatment plan. Here are some tips for making the most out of therapy. Before each session, write down what you would like to discuss with your therapist. This will help you stay focused and make the most of your time. Be honest and open with your therapist. This will help build a strong therapeutic alliance. Follow through on homework assignments. This will help you practice new skills and apply them to real-life situations. Don't be afraid to ask questions. If anything is unclear, it's important to be patient. Therapy takes time, and it's not always easy to open up. However, the benefits of therapy are great. It can help you gain insight, develop coping skills, and improve your overall mental health. Lastly, here's what to do if you don't feel comfortable with your provider. You can try to talk to them about it and see if you can resolve the issue. If that doesn't work, you can ask to be referred to another provider. Most mental health providers will accommodate this request. You may also want to contact your insurance company for a list of in-network providers. Thanks for watching. I hope this was helpful. Please share this video if you think it will be helpful to someone else. Subscribe to the channel if you like this video and want to see more like it. Leave a comment below if you have any questions or feedback. I'll see you next time.
Thanks for watching. Like, comments, and share.